Hello, everyone. Thank you for joining us on today's webinar. We're going to get started here in just a couple minutes.
Welcome everyone to our webinar on heat illness prevention and fatigue management. This is Karen O'Hara. I'm the Director of Marketing and Communications with WorkCare and your moderator for today's session. During the webinar, you will be on mute. Please submit your questions using the Q&A function in Zoom, and we'll answer as many questions as we can at the conclusion of the presentation. We have an hour for the webinar, so we expect to have plenty of time to answer all your questions. The webinar is being recorded, and we'll be uploading it on WorkCare's YouTube channel within the next 48 hours. For those of you who join us for other webinars, you'll be excited to meet two new presenters who have joined our team in the last few years, and I'm excited that they're going to be able to share their knowledge and expertise with you. The first presenter you'll hear today is Sarah Johnson, MD, M.P.H. She's an Associate Medical Director with WorkCare, and since joining our team in 2020, she's been pretty immersed in our COVID-19 response, primarily with a focus on the entertainment industry, but she has in-depth experience on injury prevention and management. And joining Dr. Johnson as our second speaker is Kála Earley, who's a certified athletic trainer, and she works closely with clients in all types of industries. She's associated with our industrial athlete program as a regional manager, and you'll enjoy hearing from her about how she helps employees stay safe, healthy, and on the job through coaching, wellness education, and a focus on prevention of musculoskeletal injuries. So now I'll turn it over to Dr. Johnson. Thanks again for joining us.
Good morning, everyone. My name is Dr. Johnson, and I'll be taking you through the first part of our presentation. I'm just going to go ahead and share my screen here. So first of all, why should you be interested in heat illness and prevention? About a month ago, OSHA adopted a new program called the National Emphasis Program, or NEP for short, that's going to target 80 different industries, mainly focusing on things like construction, agriculture, maritime industries that are at high risk for heat, injury, and illness. This will go into effect, especially on days when the local heat index is 80 degrees Fahrenheit or higher, which we'll talk more about that later. With this new NEP, OSHA can also do proactive inspections, meaning they don't have to wait for an injury or illness to occur in order to come on your site and examine what's happening with your workplace and with your workers. Each OSHA region is expected to increase the number of their heat inspections by 100% compared to the 5-year average in the past. So that's really important to know. And then also heat has a lot of potential costs both to the employer and employee, whether it's from direct costs like injuries or illnesses or fines. So what kinds of things will OSHA inspectors be looking for? So number one, they're going to be looking to see that you have a written program that addresses heat injury and illness. They also want to make sure that you have a way of monitoring the temperature to know when your employees are most at risk. They want to know, do you have hydration, cooling stations, shaded rest areas? They want to know that you're making sure workers are getting acclimatized or adapted to the heat. We'll talk more about that later. They also want to know, do you have a buddy system in place on those extra hot days when the risk is the highest? Also, you should have administrative controls in place, things like scheduling the most strenuous work at the beginning or end of the day when the heat is the lowest. Have you trained your employees, your supervisors to know how to recognize heat illness, how to administer first aid, and how to prevent it in the first place? So by the end of this presentation, we hope that you'll be more comfortable with understanding what heat illness is, how you can prevent it, and if it does occur in your workplace, how you can address it. So the first thing I'll talk about is the heat index. So this is an important metric that OSHA will be using. Again, if your heat index is 80 degrees or higher, that is a day where you're more likely to get an inspection, whether or not you're a part of that high risk target group. So the heat index is important because it tells you how hot the air actually feels. And it's a combination both of the actual air temperature and the relative humidity. The higher the humidity is, the hotter the air will feel. And the reason that is that when there's more moisture in the air, it's harder for your body to cool itself because that evaporative mechanism of sweating isn't as effective in highly moisturized air. So you can see at a temperature of as low as 80 degrees and a humidity of 40%, you're already in that red flag zone for OSHA with a heat index of 80 degrees. So climate change, we've all heard a lot about climate change. It is increasing the number of extreme heat events that we're seeing. In fact, since the year 2000, we've seen 15 out of the 16 warmest summers globally that have ever occurred in history. So it's just getting worse. And they're predicted to continue to become longer, more frequent, and more severe. And you see this illustration from the EPA showing that mortality rate over the next 100 years is projected to increase, especially along the South and in some of the eastern states along the East Coast. Okay, so let's look at a sample case. So we have a 34-year-old male construction worker. He's been working in this job for several years, but he's been away on a 1-week vacation to Alaska with his family. When he returns to work on his first day back, the expected temperature is 97 degrees with a 60% humidity. So if you think back to our previous heat index slide, you can already start to predict, whether or not this man is going to be at risk for heat illness. So first, what is heat illness? So heat illness occurs along a continuum. The least severe form is heat rash. The most severe form is heat stroke, which can actually be deadly if it's not recognized and treated promptly. We'll go through each of these in detail, including what you can do to treat them if they occur in your workplace. But first, let's talk about predisposing conditions. So you should know anyone can get heat illness, but there are certain things that make you more likely to get it. So number one is having a prior history of heat illness. This is why heat exams in the workplace are important, so you can identify those workers who are most at risk. Anyone over the age of 50 is more at risk, being overweight, having a heart disease or poor circulation like diabetics, a worker who's pregnant, someone who's out of shape, a person who's dehydrated, anyone with a recent illness. This becomes important currently because with the pandemic, you're very likely to have workers coming back who just came back from a COVID illness. Those people are at higher risk. Certain medications like high blood pressure medicines, heart medications like beta blockers, some antidepressants will also put people at higher risk. Alcohol is a diuretic, so drinking alcohol within the prior 24 hours puts you at a greater risk for heat stroke. New employees, again, doing things like a pre-employment exam with a heat exam component can help you recognize these people. And then also an experienced employee who's been away from work. Once you've been away for about 4 days, you start to lose your heat tolerance. So it's important to keep an eye on these employees. So what are some environmental risk factors? So obviously things like a heat wave, so a sudden change in temperature, when you have a high heat index, like we discussed previously, anyone who's working in direct sun, like a construction worker or an agricultural worker, is at higher risk. The lack of wind or breeze can cause this, but also if it's very hot and the breeze is hotter than the body temperature, can actually exacerbate heat illness. People who are working close to hot equipment, so that's things like indoor workers, are also at risk. And if there's a workplace culture to just push through, keep working despite how you feel, your workers are at higher risk. Also working for several days during a heat stroke, doing strenuous activity, not taking enough breaks. And then if you're in a workplace where people have to wear really heavy clothing or PPE. So going back to our case, what are his risk factors? So he hasn't had heat illness before, but he's been away from work for several days. So that puts him at risk. So he needs time to acclimatize to the heat. Also, if you look at the temperature and humidity for that day, that puts us at a heat index of around 120 degrees. So well within that OSHA red zone. So these are some of his risk factors. So what things can be done to prevent heat illness in this employee and just in employees in general? So it's really important to understand that heat illness is preventable. So there are things you can do to stop your workers from getting sick and injured. The number one thing is acclimatization. This is really important to make sure that when those temperatures go up, you're giving your workers time to get adjusted to the heat. It takes about 1 to 2 weeks to fully acclimatize, so just keep that in mind. During that time period, you want to do shorter shifts in the heat, rotate people in and out. A buddy system is really important. That's something specific that OSHA will be checking for. And this is so that you're not just relying on that one employee to identify when they're sick, you have other people watching them. You want to make sure your employees stay hydrated. People often ask, how much water should I be drinking? In general, when you're in direct heat, you want to be drinking a cup of water about every 15 to 20 minutes. The goal should be to have clear to pale colored urine, should be urinating frequently. People also ask how much water is too much water. Really varies from person to person, but the danger of drinking too much water is getting something called hyponatremia, which can cause fatal brain swelling. But if you're eating meals and snacks regularly, that will help replenish electrolytes and lower the risk for developing something like that, which is rare in general. So just make sure your employees are drinking water regularly. Don't wait until you're thirsty, and make sure you're not skipping meals and snack breaks. Employees also need to take frequent rest breaks in shade. Air conditioning is actually preferred. There is a misconception that going into air conditioning causes you to lose heat tolerance, but that's actually not true. So if you have air conditioned areas available, that is preferred. You also want to make sure you're avoiding heavy exertion, especially before people have been acclimatized. So going back to our case, what kinds of things can we do to prevent heat illness in this employee? So risk stratification. So if you have a well-educated risk force, a supervisor should be aware this guy's been away for about a week. He might have lost some of his heat tolerance. So we really need to ease him into the workload. You also want to make sure that his buddy or his supervisor is checking on him, making sure he's stopping frequently to drink water, that he's taking his meal breaks, and that he's also taking breaks in a cool area like shade or with air conditioning. So let's look at a second case. So this is a 67-year-old factory worker. He has a history of high blood pressure and heart disease, and he had a bypass surgery about 2 years ago. He's been working in a warehouse, so he's indoors, but there's a heat wave going on that started about a day ago. He's been taking water breaks about every hour, but his coworker notices he seems kind of tired and grouchy, which isn't his normal personality. His supervisor goes over to investigate and finds out the employee is nauseous and has a headache. He also noticed his clothes are soaked through with sweat. So what's happening with this employee and what needs to be done? So let's go through heat illness. So starting with the least severe form, heat rash. This is something probably most people on this call have had. So what you'll see is little clusters of red bumps, can look like pimples or blisters. They usually appear on bendy areas of the body. So like your elbow creases, the groin, the neck, can also be on the chest. The first thing you want to do, and you'll notice this is the recommendation for pretty much any heat illness, is get the employee out of the heat. So move them to a cooler, lower humidity work environment. You also, if it's available to you, you want to check vital signs. These rashes are best kept dry. So you don't want to put ointments or creams on them, but you can apply powder for comfort. This is sort of the first warning sign that your employee needs to do some extra steps in the heat. So taking more frequent breaks in the shade, making sure that they stay hydrated, using protective clothing to protect them from the sun. So next up is heat cramps. So these might occur in the arms, the legs, the abdomen, just painful muscle spasms. Again, first aid is just getting them out of the heat, getting them to a cool shaded environment. If you can check vital signs, you should do that. Next step is to have the employee rehydrate either with some cool water and a snack, or giving them a sports drink like Gatorade or Pedialyte every 15 to 20 minutes. They can just sip that. Sometimes you'll see a recommendation to use salt tablets, but you should actually avoid using them. They can have dangerous side effects, and having someone either eat a snack or drink a sports drink is more than enough to replenish the lost electrolytes. These employees should not go back to work in the heat for at least 3 hours and after their cramps have gone away. And if your employee has an underlying history of heart disease, they're on a low sodium diet, or the cramps don't go away within 1 hour, you need to send them to a medical facility for further evaluation. Next up is heat syncope. So syncope is just a fancy word for fainting. So these kind of people, they might report feeling dizzy or lightheaded, especially when going from seated to standing or from lying down to standing. This kind of fainting should be brief. So if someone faints and they're out for several minutes, that's a more serious condition. Heat syncope is just a quick fainting episode. So the first thing you want to do is get this person out of the heat into a cool shaded environment, preferably air conditioned. If you can check vital signs, you should do so. Have the employee either sit or lie down. And then once they're feeling better in a seated position, as long as they're awake and alert, you can have them sip some water, some juice, or a sports drink until they're feeling better. If this person seems out of it, they've hit their head, or anything else just feels off to you, I recommend having them go to the nearest medical facility for evaluation just to be safe. Next up is rhabdomyolysis, or rhabdo for short. This can occur from being in the heat, doing high exertional activities. It can also occur with very strenuous exercise, like people who are running marathons. You'll see this in them sometimes. But basically, muscle breakdown can damage the kidneys. They might not have symptoms, or they might have cramps, pain. They'll usually have dark colored urine, like tea or cola colored urine. They might feel weak, and they might have poor exercise tolerance. So these people need medical care. You want to get them out of the heat right away, get them to a nice, cool, shaded area. You can check vital signs, you should do so. Start hydrating them, preferably with water, and they need to go to a medical facility. Most likely they'll be treated with IV fluids there. Next up, so this gets us really into that danger zone. So this is heat exhaustion. So heat exhaustion, person might present with a headache, a rapid heartbeat. So anything greater than 100 beats per minute is considered rapid. They might feel nauseous. They might start vomiting. They might have fast, shallow breathing. So anything greater than 20 breaths per minute is considered fast. They might feel dizzy, lightheaded, complain of being weak or feeling tired. They might be irritable, grouchy, like our sample case. They might complain of thirst, be sweating profusely, have an elevated body temperature like 103, 104, and also decreased urine output. This person, this is an all hands on deck kind of situation. So someone should immediately call 911 while another person moves the employee to a cool shaded environment, preferably air conditioned. You want to get them cooled down as fast as you can. If you're able to check vital signs, you should do so. Someone should stay with this employee at all times. Do not leave them alone. If they're awake and alert enough to do so, you want to give them cool liquids to sip on, like sips of water. You want to take off any unnecessary clothing, including shoes, socks, hard hats, and start putting cool compresses on the worker while you wait for EMS. So prioritize head, face, neck. If heat exhaustion is not promptly recognized and treated, it can progress to heat stroke, which is fatal or can be fatal. Some of the things you look for in addition to the symptoms of heat exhaustion are confusion and altered mental status. So the person just is out of it. Their speech might not make sense or it might be slurred. They might lose consciousness. So this is different from heat syncope. This is someone who's out and you have a hard time getting them to come back. They might be stumbling around the job site, complaining of a throbbing headache. These people can either be profusely sweating or their sweating mechanism has failed and the skin is very hot and dry. Body temperature can be in the 105, 106 range, at which point you start being in danger of organ failure. These people can also start seizing. So again, all hands on deck situation, get the person out of the heat immediately while someone else calls 911. Someone needs to stay with this employee at all times. If you're able to check vital signs, you should do so. And you want to take off any unnecessary clothing, including shoes and socks. If you are in a high risk work environment, a really low cost solution is to have a tub available. And when you get the employee in the tub, fill it with cold water and ice. That can really help cool someone down quickly. If you don't have that available, you want to cover them with cold compresses, prioritizing head, neck, armpits, and groin until the EMS gets there. If you have a fan available, that can also be used to circulate cool air around the worker. Okay, so going back to our case study. So this factory worker, what's happening with him? He has heat exhaustion, right? He has a headache, he's nauseous, he's sweating profusely, his mood is changing. What should the supervisor do to treat him? He needs to be taken immediately out of the heat. Someone needs to call 911. This is an older gentleman. He has a medical history. He has heart disease. So this guy is very high risk. You need to start hydrating him if he's alert enough to do so, and then remove unnecessary clothing and apply cold compresses. So some frequently asked questions, how much time should an employer give someone to adapt to hot, humid conditions? About 1 to 2 weeks for most people. Number two, how much water should an employee drink before starting work? So this is a good question because you actually want your employees to start hydrating before they even get to the work site. So if you know a heat wave is coming, it's a good idea to have your supervisors let employees know, hey, you need to start drinking the day before and really get yourself hydrated before you even get to the work site. Water needs will vary from person to person, but in general, about 15 cups a day for men, 11 cups a day for women is sufficient. If you're working in a hot environment, you should be sipping about a cup of water every 15 to 20 minutes when you're in direct heat. Question number three, are there certain signs or symptoms you should watch for intervention? Someone who's sweating profusely and anyone who's just acting differently to you. So they're tired, they're irritable, they seem confused. Those are really red flag symptoms that you need to get them out of the heat and apply first aid. And then finally, what's the best thing to do immediately for someone if it's not a medical emergency? The top two things are get them out of the heat right away and start providing hydration. Okay, so I will go ahead and pass off the slideshow to my colleague, Kála.
Paula, we're having an audio issue.
Are you all able to hear me better?
That's better. Yeah, we couldn't hear you at all.
Oh, goodness. Here I am rambling on. Oh, I
You
greatly
might want to
apologize.
start over.
That's
It is-
exactly what I'm going to do.
Thank you.
All right. Thank you all. Give me 1 second to go ahead and backtrack just a little bit.
There must have
but let
been
me
a
just go-
lapse.
Absolutely. Well, I apologize, everyone. But thank you so much, Dr. Johnson, for providing such a really thorough background in heat injury, and illnesses, and then how we can combat that. So we are going to go into a different approach on how to reduce the risk of injury and illnesses, and also to reduce the risk of fatigue as it applies to extreme conditions and environments that can be both hot and cold. So the reduction of injuries, I like to take a three-pronged approach to it, and that's going to be with training, acclimatization, and hydration. So the first of which being training, which is like a physical fitness that applies to protecting and preparing the body for the job that's at hand. What you'll notice is there's several terminologies that surround this, and this can be terms that you'll hear sometimes. It's work hardening, work hardness training, or even just physical fitness. And this in general is just the preparation of the body for a task that you're getting ready to do, a job that you're getting ready to do. We've also kind of gone into acclimatization, which is an incremental environmental exposure to extreme temperatures or extreme environments that promote adaptations of the body. And I'll go into a little bit more detail on each of these here momentarily. But another approach is also going to be focusing on hydration and replacing any body fluids that are lost during sweating. So work hardness training, also other terms that you've heard probably before in the past, are fitness training, early interventions with job trainings, and then also work hardening. But all of these are synonymous terms that reflect preparing the body for a task that it's getting ready to do. And it involves several different scenarios. This can also be applied in the workplace, and it can be applied at home as well. But jobs that involve any sort of vigorous activity, physically demanding tasks, our bodies need to be prepared for these things. And how do we prepare them? There's several key elements, but I like to focus in on 5 in particular. And these elements of work hardness training, fitness training, are strengthening. So strengthening the body, which pertains to musculoskeletal, is strengthening those muscles for the job. Sometimes we'll be doing a task that doesn't necessarily use muscles that we're used to using, and strengthening for overall preparation for that job is important. Endurance, this can apply both to the muscles and it can apply to the organs as well. So as to better explain, you need to be able to allow both your lungs to be ready for the activity that you're getting ready to do, your heart, and the rest of the muscle groups that you're actually going to be utilizing for the activity as well. We also want to include flexibility. Many times in the workplace, we'll notice we're working either in confined workspaces or awkward postures, and our bodies need to be prepared for that particular job task or that location of the job task. So flexibility is going to be a key aspect for preparing your body for that job. Stability, and this affects mostly the neurological response of the body, being able to also function in that job, responding to activities or jobs that you are getting ready to do. And the last one is mindfulness. So this is preparing the mind for the job as well. And those are all 5 key aspects and elements that are pertaining to work hardening, work hardness, or physically fitness training, preparing the body for the job and the task that's at hand. So we spoke a little bit earlier on acclimatization, which is promoting adaptations in the body. And to go into a little bit more detail of what these adaptations are, and then also to explain the benefits of them, it is repeated intermittent exposure to extreme temperatures or to different environments, allowing the body to be able to adapt to these environments and these climates. Many times, as we've noticed, as we're slowly integrating ourselves into the summer environment, we've got a totally new environment that our body hasn't experienced in about a year, exactly a year actually. And so now what do we need to do in order to prepare our bodies to adapt and have those benefits of these adaptations? What we'll notice is that we will, if we are accurately using acclimatization, then we're going to also increase our ability to sweat, and sweating regulates body temperature. We also want to have the benefits of regulating our circulation, so that is the blood flow in the body, and then the lower our body's core temperature. So with extreme heats, we want to maintain a core temperature that will also maintain a heart rate at its working homeostasis. So the one thing that was mentioned a little bit earlier that I do want to reflect on at this point in time is that new hires also need a little bit more time spent for acclimatization. So yes, for the average population that's been in the workforce, it takes roughly 1 to 2 weeks for our body to become climatized to a certain environment or a certain job task. I would want to just make note that if you are in a newer environment, a new climate, or a new position, that it does take a little bit longer, and that employers should be mindful of that as well. So acclimatization in the environment and climate change, what gains do we get in the workplace from acclimatization? Generally speaking, it gradually increases our time as it approaches in the workforce, and also as our time as it approaches in the environment. So that's basically to say that we do need a little bit more time as we're starting a new job in a new environment, whether it's increased temperatures or increased humidity, for our bodies to become more adapted to that environment and that climate. As mentioned before, it takes roughly 7 to 14 days intermittent exposure to these climate changes for us to be able to obtain the necessary benefits from acclimatization. And so just again to note, according to NIOSH, that it does take a little bit longer for new hires and new employees. So that should also be kept in mind for employers. And then also to note, how do we maintain acclimatization? So how do we maintain these adaptations, these benefits that our body has taken upon during this time of slow integration? It's important to note that that 2 to 3 days away from the workplace is not going to completely eliminate all these benefits that you've had during this transition process. So for those of you to understand better, the weekend is not going to completely eliminate the benefits that we have from acclimatization. However, we do want to note that a week or more can likely cause a decrease in the significant loss in our acclimatization benefits and adaptations of the body. So with that being said, maintaining physical fitness and even intermittent exposures during our time away from work can highly benefit us during this time period. So just to reflect on what are some signs and symptoms of dehydration, Dr. Johnson went into great detail on these, so we will just go through them relatively quickly. But to remember that dark urine is a really good telltale sign. So if you're seeing sweet tea from urinating, then that's a concern. Also, the lack of urge to urinate is another concern. You'll have an increase in body temperature, fatigue, irritability, dizziness, feeling faint, also getting headaches, dry skin, the lack of ability to produce tears. You can also have sunken eyes and cheeks. Dry mouth and tongue are all signs and symptoms to be aware of, for yourself, and then to also keep in mind as for the buddy system for your fellow employees as well. So why do we hydrate? It's so important to keep our bodies hydrated because as humans, we are mostly made up of water. So with that being said, 3 to 4% of the fluids are lost as a link to 25 to 50% in decline in physical performance and cognitive ability. So that basically is to say that anytime that we're losing water, whether it's via talking or a physical activity from sweating, we're decreasing our ability to function physically and also cognitively by decreasing our lack of hydration. So what does water do to help our bodies? It's so important by maintaining our normal body temperature. It also supports joint lubrication and cushions, so all those joints in the bodies, especially the knees and the hips. It's very critical for joint health, promoting and protecting our bodies against infection. It keeps all those infections moving out of the body as it eliminates waste. And then it also helps sustain regular function of our organs, and then also delivering nutrition from our cells to the rest of our body. protection of other body tissues, the rest of your organs. Those are all great effects of drinking water. So what do we drink? Again, this was touched on a little bit before, but as a reminder, for men, it's approximately 15 cups of water or fluids a day. And then for women, it's roughly around 11 cups of water or fluid a day. But there are some drinks that we do want to be aware of because even though they are drinks, they also cause dehydration. And these are things such as coffee, teas, sodas, energy drinks, and also alcohol. So even though you're putting fluid into your body, those are dehydrators. So we want to be aware of what we're putting in our body is actually hydrating us. So water is a great example, and also sports drinks. So Pedialytes, Gatorades, any of our E-Lite drinks are wonderful hydrating fluids. But we also want to continue to reduce the risk of injury and prevent fatigue in our body. So how do we do that in extreme environments? And sleep is so important. So the National Institute of Health recommends that men and women alike, all adults, should get roughly around 7 to 9 hours of sleep a night. So yes, the quantity of sleep is important, but also the quality of the sleep is as well. And why is this so important is prevention for injuries and illnesses? Because our body does so much recovery, both mentally and physically, while we are sleeping. And the lack of sleep increases the risk of fatigue, and the increased risk of fatigue increases the risk of injury. So how do we manage and combat physical fatigue, both in the workplace and at home? So physical fatigue puts us at risk because we have a higher likelihood of making mistakes. Accidents are more likely to happen and injuries are more likely to occur. So physically, mentally, fatigue reduces our ability to be cognitive, to be aware and respond necessary to the task that we're getting ready to do. It also increases the risk of musculoskeletal discomforts and injuries. How do we combat that? There are several different ways to combat muscular fatigue and also mental fatigue. Again, the first and foremost of that is getting adequate sleep. Nutrition is a really important factor. Hydration, of course, is an important factor. And we've spoken before on acclimatization and fitness. But other ways to do it in the workplace at a moment's notice is taking adequate rest breaks, also known as micro breaks, which I'll explain in more detail here shortly. But good sleep hygiene, as we've already spoken to, nutrition, hydration, and then also in taking into consideration the effects of the environment are all important, such as exposures to heat and being able to adequately make adjustments to our workforce and also to our personal lives in order to combat these environmental changes. So micro breaks, let's just take a split second to explain a little bit more so on micro breaks and how we can effectively use them in the workplace. So I've heard the term ergo breaks before, but micro breaks is one that I like to use because all it is 15 to 20 second intermittent breaks that occur during an activity. Sometimes during activity, we get so caught up in the routine and the monotony of it, or we've just gotten to the point where we know exactly what we're doing over and over and over again, that we forget that we actually need to be mindful of the task that we're getting ready to perform. So this is 15 to 20 seconds of stepping back, allowing yourself to refocus on the task, refocus on what you're doing, give your mind and your body a split-second break, and then get back into the activity. From there, you can also incorporate stretching, which is compensatory stretching. So you're going to work in the opposite direction, stretching in the opposite direction of the activity that you're performing. So I want you to take a second and imagine that you're bent over trying to change the tire on your son or daughter's bicycle. And you're doing that for the past 30 minutes because it's not wanting to come off. Well, take 15 to 20 seconds to stand back. You're going to stretch in the opposite direction, maybe leaning back, extending your back, and that's considered a compensatory stretch. So ergonomic and posture, checking for ergonomics and posture during an activity is also important whenever you're performing a micro break. You're going to allow yourself to refocus again on the task, correcting your posture because you might have been in a confined space or using an awkward posture, being bent over, changing that bike tire. And so now we're going to readjust, evaluate our body's positioning so that we're able to keep those muscles from fatiguing much quicker, because they do can fatigue relatively quickly when we're in awkward postures or when we're performing an activity for an extended period of time. It also gives ourselves to have that brain check for our eyes to refocus on what we're doing. So many times we get caught up on the, like I said, the monotony of a task, or maybe even just the routineness of a task, that we need to allow ourselves to refocus so that we're not putting ourselves at risk of injuries, of accidents, and all of the above. It's a mindfulness pause, again, to refocus, and it places ourselves in a position where our hands and mind and body are all redirected to the task that we're getting ready to do. And it also gives us a split second to refresh our bodies to move on and prevent injuries from occurring. So I just wanted to say thank you all for your time today, as we've gotten an opportunity to cover several different aspects of heat illness and injuries.
Thank you. And if you could go on, Kála, to the next slide, it shows references so that the folks can just see some of the references. And we'll have this uploaded on our YouTube channel. So we have a few questions. We'll jump right into them. So Dr. Johnson, if you could also unmute yourself, and then you can both respond. So the first question is about the heat index. Why is OSHA putting the emphasis on the heat index when it's known to be poorly correlated to risk of heat illness? I believe there was a recent court finding that addressed that.
Yeah, so I can't answer exactly why OSHA chose that metric. My guess would be that because it's easily accessible, so all you need is the level of humidity and the temperature to determine heat index. But you're correct, it's not a direct correlation to someone who's going to develop heat stress. It's just one part of the equation. It doesn't take into consideration things like direct sunlight, workload, radiant heat. So it's just one part of the puzzle, but it's an easily measurable part of the puzzle. So that would be my guess.
I understand too that the trigger is 80 degrees Fahrenheit, which a lot of people wouldn't think of as a particularly hot day, depending on where they live, for when they start to pay attention to doing inspections.
Right, and really heat illness can occur at lower temperatures depending on if someone's doing really strenuous activity like athletes practicing out on a field or agricultural workers. So 80 degrees Fahrenheit heat index is just the level at which, further inspections are triggered, because that's where the risk is higher, but it can occur at lower temperatures than that.
Okay. Kála, did you want to add anything about what you've observed when you've been visiting different types of industrial work sites?
Absolutely. So I've had the opportunity to observe several different work locations in several different climates and environments. And the fact that many clients take on the opportunity to bring in and hone in on the focus of heat index and humidity, depending on the locations that they're at. Education to your employees is extremely critical, that they know how to identify their personal signs and symptoms to be able to move forward on not only for their own personal health, but identifying those for their colleagues as well.
Okay, this is an interesting case study. Just this week, we had an employee lose consciousness due to heat-related illness on the job site. The employee refused medical care, which left his coworkers in a very uncomfortable situation. Looking for advice on how to handle this situation going forward. Employees can refuse medical care, but also need to factor in the level of confusion of the employee in this situation, which could also apply to a head trauma situation. So what advice do you two have in this case?
Yes, that's a great question. What I would recommend in that situation is just emphasizing to the employee that you're concerned about their condition and going ahead and calling for EMS. they can come on site and the employee can, if they still want to refuse medical care, they can refuse to the EMS. And then you have documented at least that you recommended care and that you tried to provide care, but the employee refused. Because you're right, they could have a head trauma situation, but the EMS would be better qualified to make that determination if they just need to bring the employee in, against their wishes.
Seems like that's the safe way to go.
Yeah.
Kála?
Absolutely. That was beautifully articulated, Dr. Johnson. I would also have to agree, as it also provides you a second layer of security as the employer to know that not only is it documented on your end that the heat illness occurred, but it also is documented on base from the EMS team, and they can also make that secondary decision. So I would have to concur that that's the best mode of action.
I would also think that it's a training issue and educating employees, before they experience any kind of injury or illness, what the expectations are as far as first aid and medical intervention. Like in this situation, the person may have been confused and not making good decisions, but at least they had the information they would need in the event something should occur, or if they're helping someone else.
Right.
Absolutely.
So next,
education.
Oh, go ahead. Sorry.
I was just going to add to that to say education is extremely key in promoting the information that's available to your workforce on heat-related injuries and illnesses and effects that can occur in the long run as well. So not only does it happen in the moment, but how is this going to affect their quality of life in the long run, inside and outside of work? So that is good information to share. And the more information and knowledge that the employees do have, the likelihood of scenarios like that can be reduced.
Great, thank you. Next question. What do you recommend we tell employees who say, I never eat breakfast and I don't eat or drink until lunch? What are some specific benefits of eating breakfast and snacks we can share with them as it relates to their work?
Yeah, so this is pretty common. I'm actually one of those people who doesn't really like to eat breakfast, but your employees just need to be educated that on days when it's really hot, eating and drinking, including breakfast, is very important because number one, some of our fluids come from the foods we eat. So things like fruits and vegetables have a very high water content. So that can help with hydration. And then also that's the way that you replenish electrolytes. So when they're drinking lots of water, they're not getting, a dangerously low salt content in their blood. So just let them know, I know you don't normally like to eat breakfast, but in order to keep you from getting sick in the heat, it's really important that you do eat breakfast and drink regularly during, high heat conditions or when you're doing strenuous activity outdoors in the heat.
Is there anything in particular people should eat for breakfast? Especially those people who don't really like breakfast?
Yeah, I mean, you want to have some kind of carbs. So maybe having like a bagel or toast. It's good to have some kind of protein. You could put something like a nut butter on toast. Things with electrolytes like bananas are good to eat. Having some orange juice to drink. It really does vary from employee to employee because you might have an employee who has some medical conditions that dictate what kinds of things they can eat. So you can make general recommendations, but let them know, if they have any particular health and concerns, they should consult with their doctor as well.
Okay. Kála, you want to add anything?
I would love to. I just want to continue to add to that to say it might be a silly analogy, but I love to use this analogy when talking to anyone. And it's basically to use the analogy of your vehicle. You put gas into your car so that you can drive somewhere. But if you're running out of fuel, you can't expect your car to continue to run. Well, food is the same as gas is to your car. You have to fuel the body so if you're going to expect it to be able to continue to function. And I know that might be a very silly and simplistic analogy, but I love to use it. It's down to earth. It's a great example for individuals to realize that we've got to kickstart our body after having almost 7 to 9 hours of rest of starvation because you're not eating in the middle of the night and you're continuing to starve your body throughout the morning and now you're putting it into physical activity. So those are all really good examples that I like to use whenever we're educating employees or anyone really on why it's so important to put fuel into your body because you need to expect it to function whenever you need it to, and the only way you can do that is by fueling the body.
Yeah, that's a great analogy. And as a parent, I never let my kids go to school without having breakfast. And even though I had to kind of sometimes force them to eat, that was just part of common practice. But now as a grown up, I'm like, I'll have a cup of coffee. So got to practice kind of, set a good example, I think is another aspect of it. So Dr. Johnson, this is a good question because I was thinking about having you elaborate on it also. The commenter says, I thought I heard you say that electrolyte tablets, salt pills should be avoided. Is that correct? We currently have them available plus sports type drinks.
Yes, so that is correct. You do not want to use salt tablets for someone with heat-related illness. Generally speaking, having them either drink some water with a carbohydrate-heavy snack or having them drink an electrolyte replacement beverage like a Gatorade or Pedialyte is sufficient to replenish electrolytes. When you're giving a salt tablet and you're on site and there's no real medical facility there, it's hard to determine what the person's salt deficit is. It's hard for you to know if you're dosing them properly. So that's something I would leave to a medical professional to do. When you're on site at the workplace, a carbohydrate snack and water or a sports beverage are more than sufficient to replenish electrolytes in those situations.
Okay. And Kála, what do you recommend we tell employees who say they only need 5 hours or less of sleep and that this is customary for them? I personally really like to sleep, but I know a lot of people who say, oh, I can get by on 4 or 5 hours. So we all run into that.
It is a great question, and being one that used to pride myself as well on getting 4 hours of going through school and working, and then realizing that I was not able to function at my fullest once I changed my habits. The biggest aspect that I would really want to bring out is the fact that you are able to allow your body the opportunity to recuperate and recover during sleep. It's so critical. Your body only does most of its recovery process while you are resting. That's mental recovery, physical recovery, and it causes your body to reach that level of homeostasis again. And so, yes, I know we've all have very, very busy lives, and it can be very difficult to fit in that amount of sleep, whether it's work, personal life. However, the benefits that come from the rest and recuperation that occurs during the sleep is so important. And you'll realize that your cognitive and physical function is able to beyond what you thought that was what you were priding yourself on before with only 5 to 4 hours of sleep.
One commenter says, I tell employees they're listening to a sleep-deprived brain, which is not functioning properly. We can talk ourselves into a lot of things. I was wondering if you both could elaborate on pregnancy, because your body is functioning in a different way, and a lot of women who are pregnant just say they feel warm anyway. And so I'm wondering if you have some specific recommendations for pregnant employees.
Yeah, so pregnancy is a time where you have significant fluid shifts, you have a greater blood volume. So these people are at a higher risk for heat-related illness. In terms of specific recommendations, you just want to make sure that these employees are really listening to their body. If something feels off, they need to get out of the heat. As much as possible, I would try not to expose pregnant employees to the heat just because they're at a higher risk already. And then, you're dealing not just with the employee, but you're also dealing with the fetus. And so, there's a lot of risk there legally. So I would recommend, if you can, keeping those employees out of the heat. If not, trying to prioritize outdoor tasks either early in the morning or later in the evening when the direct sun isn't out, it's not as hot, making sure they stay appropriately hydrated, they're not skipping meals, and they're taking frequent breaks, and also that they have a buddy system in place where someone's keeping an eye on them.
Okay, Kála, you deal with pregnant employees just to keep them from musculoskeletal injuries also because their body shape is changing. How would that tie into the fatigue and injury heat-related conditions?
Absolutely. So So during the time of pregnancy, your body is basically an incubator. And yes, you will notice there's already a little bit of an elevated body temperature, which puts you at risk for having other heat-related injuries and illnesses. So the best thing, and just as Dr. Johnson said, is being mindful and listening to your body. I also highly encourage those individuals, if possible, if at all possible, to maintain climate-controlled environments, just because that also has the legal repercussions of an individual who might experience any sort of heat-related injury or illness due to pregnancy, and then also the increased body temperatures. But in that environment, knowing that your body is going through changes, education is key. If you have the ability to continue to talk to your primary care provider on those changes that are occurring, it is good to notice that, yes, I am going to be a little bit more tight. What can I do to combat that? Knowing how to properly stretch, properly maintain nutrition, properly maintain hydration, and getting adequate sleep. These are all wonderful things in order to maintain that body, as it is an incubator for protecting both yourself and then also the fetus.
Okay. I was wondering about people who suffer from night sweats for various underlying medical conditions. Does that make them more at risk for heat illness?
It depends on what the underlying condition is. So if they have some kind of heart disease, if they're diabetic, those things would put them at higher risk. If they're sweating because of some kind of infection, like some infectious disease, that would put them at higher risk. But yeah, it really just depends what the underlying cause of night sweats is. But in general, you just want to make sure your employees are staying hydrated, not just during high temperature times, but all the time, because you never know when a hot temperature is going to come. Sometimes they're more unexpected. And just making sure that when they show up to the work site, they're already hydrated and they're not trying to play catch up is important.
Okay. What can an employer do about bathroom breaks for people who don't want to drink a lot because they don't have access to a bathroom where they're allowed enough time to even get to it and back and not interrupt their shift? Do you see that happen very often? And what do you recommend in those situations?
Yeah, it's important to provide a nearby area for bathroom breaks. Otherwise, that will discourage your employees from drinking adequately. If someone is drinking enough water, they should be urinating frequently. They should have clear to pale colored urine. So if you need to provide a porta potty on site or some other mechanism, I would highly recommend that, because otherwise, if it's really inconvenient to get to a bathroom, people are not going to drink enough, and you're going to run into the risk of those people getting a heat injury.
Absolutely. And one thing I would add to that as well is, as important as production and productivity are, we also have to realize that productivity is increased when the individual is feeling at their best and they are the most healthy. And so focusing on that safety aspect of, are they staying hydrated? Are they getting enough to drink? Are they having sufficient amount of breaks, is going to increase that level of productivity for the employer. And so as Dr. Johnson said, having that accessibility to those breaks and having that accessibility to those facilities are going to be really good ways of supporting that, along with the knowledge of what intake of water and sufficient hydration is going to be, and saving themselves from potential injuries and then from potential heat-related illnesses as well.
Okay, great. We have time for one last question. I recently attended the American Occupational Health Conference and attended a session on heat illness. And it was brought to people's attention that one industry that seems to be a higher risk but hasn't really been that much on the radar is delivery drivers who sprint in and out of their vehicles to make deliveries at doorsteps and at businesses all day long. And I wondered if you could address some recommendations for that particular audience, because you see these people everywhere and you kind of wonder what's being done to protect them.
So these people, they're doing strenuous activity, probably lifting heavy packages. They're in the direct sunlight, which also contributes to heat stress. So for these people, I would say it's important that they're taking regular breaks when they're in their truck. Having on the air conditioning, if possible, is a way to help, with a cool shaded break. Also making sure that they have plenty of water with them and that they know there are areas where they can stop and use the bathroom. So those would be my main recommendations.
Absolutely, I would have to second that. I am very aware that individuals who work in this industry, they do put themselves at an increased risk for any sort of extreme heat or heat illness. And with that being said, also providing them with the right PPE in order to combat that as well. There's great tools that are out there that can help with the reduction of body heat and also just external heat that promotes our body to be able to regulate itself. So being aware that there are PPEs out there that are available, and then also other extra technologies that can monitor their heart rate, their level of perspiration, to be able to just know when you need to take that break and identify if that individual is experiencing symptoms, whether they're physically with you, because a lot of times these individuals are working by themselves. And unfortunately, in that case, we can't implement the buddy system. So there are technologies out there that can also identify and keep track of the individual's heart rate, the level of sweat that's coming from their body, how much they've run throughout the day, all of the above. And this is a really good identifier on initiating breaks to send them notifications to say, hey, it's time to pause for a second, sit in your truck, and then continue to do the work.
Great idea. We're out of time. Thank you so much, Dr. Johnson and Kála. Thank you all in our audience for joining us today. Please send any questions you may have to communications@WorkCare, and I'll make sure they get to the correct people to get your questions answered. We have a lot of resources available. In addition to our two great speakers today, we have considerable depth of resources. So please take advantage of that. And we'll look forward to seeing you back at our next webinar. Thanks again.